Welcome back, everybody. Did you know that every 3 minutes, someone in the United States is diagnosed with blood cancer? And did you know that more than 1 million Americans are living with or are in remission from a blood cancer? It's an important conversation to have. So today, we've got an expert here to tell us more about what blood cancer is and the signs that something may be wrong. Please help me welcome Dr. Laura Finn, the Section Chair of Hematology at Ochsner MD Anderson Cancer Center. Thank you so much for joining us today, Doctor.
Yes, thank you for having me.
It is such an important conversation. My goodness, every 3 minutes, that is a lot of people. First, let's talk a little bit more about what exactly blood cancer is.
Yes. Blood cancer is an abnormal growth in one of the 3 types of our blood cells, usually a white blood cell. So our blood system makes 3 primary cells: white blood cells that help fight off infections, red blood cells that carry oxygen to our organs and give us energy, and we have platelets that prevent us from bleeding when we have a cut.
Clotting.
Clotting. So blood cancer occurs when there's mutation in the DNA of the blood cell, or there's specialized communication systems in these cells that tell them when to grow, when to multiply, when to die.
And what's so interesting about blood cancer is that there are 3 different types. When people hear blood cancer, they may not know necessarily what it is, but when you tell us the 3 types, they'll definitely know what it is.
Yes. The 3 main categories of blood cancer are leukemia. That is a blood cancer of our white blood cells, occurs in our blood and our bone marrow. As a category, it's the #1 blood cancer of adults. In children and adolescents, it's actually their #1 type of cancer overall. There's also lymphoma, which is a blood cancer of our lymphatic system, affects our blood, our bone marrow, and organs of our body called lymph nodes. And then multiple myeloma, which is a blood cancer of a specialized white blood cell, a plasma cell. And this also happens in our blood, our bone marrow, and bones, and can also cause kidney failure.
And why is it so common? Like I mentioned, 1 in every 3 minutes. How is it caused, and what are some of the symptoms?
One reason it's so common is because as a blood cancer, there are actually dozens and dozens of different subtypes. So the more common forms are these indolent blood cancers that we find usually by routine blood work. Your primary care physician may be performing, and we find it, we just have to monitor it. It's less common to have the aggressive forms of blood cancer like the high-grade leukemias. What causes it is largely unknown. We can't quite pinpoint exact environmental factors for everyone, but there is research ongoing to try to identify what is it within our genetics, since we know it can affect the DNA and communications in our communication systems in our cells. What are these mutations that actually happen, and are there environmental links that can cause them? That's an active area of research.
And you know, there are some symptoms that you all need to be aware of. Now, take a look at your screens. Now, if you have these symptoms, that doesn't necessarily mean you have blood cancer. But if you are diagnosed with blood cancer, you can come to Ochsner, the MD Anderson Cancer Center. Congratulations, by the way, on that new partnership.
Thank you.
This is so big. There's a program that you all offer that really is a first of its kind here in Louisiana. Talk to us about that treatment.
That's right. You're referring to CAR T-cell therapy, which is abbreviation for chimeric antigen receptor T-cell therapy.
Say that 4 times
right.
fast, Lord.
It's a tongue twister, but it's a fascinating therapy for blood cancers. It can be used to treat specific types of leukemia, lymphoma, and multiple myeloma, so there's 3 big categories. What it is we take a patient, we actually use a special type of their own immune system. It's called a T lymphocyte. That's the T cell of CAR T-cell therapy. We collect it from a blood collection from the patient. It's then sent off to specialized drug companies that make this therapy to genetically alter the T cell to have a receptor for the proteins on the surface of the cancer cell. So it's like specially designing the T cell to recognize that patient's cancer. It's brought back to the treatment center, and we give it back as an IV drip. So exciting that Ochsner this summer actually treated the first adult patient with blood cancer of this FDA-approved CAR T therapy. We're the only treatment site in the state of Louisiana.
And congratulations on that as well. And you know, there are things that we as individuals can do to help with blood cancer, becoming a registered bone marrow transplant donor. It's so important. Doctor, I want to thank you so much for being here. I appreciate your time. And look, everybody, if you want more information about all that they can do at the Ochsner MD Anderson Cancer Center, to find out more about how you can become a bone marrow transplant donor and so much more, log on to ochsner.org/endcancer. Good luck to everybody out there. We'll be right back.